Hey, I'm Dr. Nathan Miller. I've been with Sono Bello now for almost a decade, and I'm here to talk with you today about realistic expectations. Now, realistic expectations are a difficult thing. They're probably the most important thing that we discuss, but they're probably also the most difficult thing that we discuss. Why is that? Well, I was raised in such a fashion that you never ever pointed out things to people that maybe were not quite as flattering as they might be otherwise. However, especially in cosmetic surgery and liposuction specifically, it's imperative that these things are covered. What do I mean by that? Well, when I lecture to medical students, when I lecture to fellows, when I lecture to residents, one of the things that I really emphasize to them is the necessity to get on the same page with their patients as far as what can be expected realistically. You got to lay down that baseline of realistic goals. You know, the buzzword, as I've mentioned in this business, is realistic expectations. We like to live in what I like to call the Kim Kardashian society, where folks will watch these reality TV shows or nip tuck or things like this, and they'll come in envisioning something, and I've got to make sure that that's something that I can do for my patients. So one of the things that we specifically look for in liposuction are the presence of stretch marks or extra skin areas, or possibly procedures previously done like tummy tucks or breast lifts or facelifts that might indicate previous periods of extra skin. All those things are kind of, I guess, really more kind of a flashing red neon sign that says, hey, this patient's skin elasticity maybe is not quite as good as it once was. And that's okay. That's just part of being a person. But it also does put patients at a little bit higher risk for rips and more like extra scar tissue being produced. And when that extra scar tissue is present, sometimes it creates ripples or lumps and bumps and things like that. And so we have some ways to kind of prevent some of those untoward outcomes just by simply massage and things along those lines. We also tend to look for indications of maybe somebody who's had a larger baby before and it's stretched out their abdominal muscle. That can make it a little bit difficult getting across to the patient that, hey, you may not have a completely flat belly when this is all said and done. So again, one of the keys that I feel to the success that we've had over the years at Sono Bello is, once again, making sure that we're on the same page with our patients. When you discuss these things preoperatively, you're a thorough, you're a caring, you're a succinct surgeon. But when you discuss these very same things postoperatively, you sound like a charlatan. You sound like you're trying to sell somebody the emperor's new clothes, which is not at all what we're about. And that's why I feel that just discussion of the realistic expectations and, once again, getting on the same page with that patient is just really important.